Thank you everyone for joining us for this Brain Health and Wellness series of seminars. My name is Dr. Ben Rhodes. I'm the Direct Programs Operations Manager here at the Ventura County Area Agency on Aging. It's my privilege to serve as a MC tonight and to introduce our speaker. First, let me give a couple of housekeeping matters. So this is a webinar style. So if you have questions that come up during the presentation, feel free to enter those in the chat. I'll make sure to ask all of those questions and Sylvia will answer them at the end. And we'll also, if somebody has had a challenge typing in, let us know and we can unmute individual speakers for Q&A at the end. Without any further ado, let me introduce our speaker, Sylvia Taylor-Stein, who is the Executive Director of the Ombudsman Program here in Ventura County, who was introduced to the Ombudsman Program in August of 1999 and became actively involved in the same year. Sylvia and her husband, Mark, native Californian, have 5 adult children and live in Ventura County. Sylvia's greatest inspiration in her life was her grandmother, who died at 92 years of age after suffering with Alzheimer's disease for 10 years. It's this love and deep respect for her grandmother that influenced her desire to become involved with the elderly population and the exceptional advocacy work of the Ombudsman Program, which we'll be hearing about in a moment. Sylvia received her higher education at Ambassador University in Hertfordshire, England, and the University of Northern Kentucky. Her work experience is extensive in the area of publishing, marketing, management, including nonprofit management, and public relations. Prior to joining the Ombudsman, she was the executive vice president of an international publishing company for 12 years, where she also served as director of its private foundation. And Sylvia, I'm going to read this short quote, which will open it up for you. Sylvia says, "My grandmother was blessed to live and die at home with loving people around her. This is not the case for most of our elderly in long-term care. My goal is to help build a strong Ombudsman program here in Ventura County that can provide the effective advocacy care and support they need and deserve." Over to you.
All right. Well, thank you very much, Ben. It's a real pleasure to be with all of you here today. First of all, I know this is a webinar, so I don't have the ability to know how many of you have actually been in nursing homes or how much you know about the Ombudsman Program. I see some of my folks on here, so I know that they know all about the Ombudsman Program. But for those of you who may not be as familiar with us, we're pretty invisible because we serve a very invisible population. We serve those who are living in nursing homes and in assisted living and board and care homes, most of whom are vulnerable, frail, disabled, suffer from some type of cognitive impairment. And due to confidentiality requirements by the federal government, we are bound not to discuss a lot of the cases that we have and the complaints that we investigate. But today I would like to share with you what we do. You know, what exactly is an ombudsman and how do we do our job? So I'm going to share my screen. Share screen. Pull this up. Okay, here we go. Let me get out of here. All right. So our mission, the Ombudsman mission, is to help ensure the highest quality of life possible for the disabled and frail elderly persons who live in long-term care. Now, I use the word elderly loosely here because we're getting more and more younger people in our nursing homes in Ventura County due to homelessness, addictions, mental illness. Many of these individuals have nowhere else to go. So they are now becoming part of the population that we are serving in the nursing homes, in the long-term care facilities. And that in itself brings its own problems when you mix a population of younger people with mental health issues with elderly folks who have lived their life and are more frail and compromised. So our job is to advocate for all individuals who live in these facilities and work really hard to help them have the best life they can have for the rest of their life. The premise behind what we do, we believe all life has value. Older adults deserve to live in the least restrictive environment free from fear with the highest quality of life and care possible. That's the Nursing Home Reform Act of 1987. We're still striving to meet this. We're still fighting for them to live in the least restrictive environment, free from fear with the highest quality of life and care possible. So that's an ongoing challenge for those of us who work in this field. Who is an ombudsman? Ombudsmen are federally mandated advocates who fight for the rights and needs of elderly and disabled residents living in nursing homes and other long-term care facilities. Something really important to know is that 60% of the residents in our nursing homes have no family or friends who ever visit or check up on them. Now, I'm speaking strictly of nursing homes, not assisted living. We have 19 nursing homes in the county, and I'll tell you how many folks are living there shortly. But there's no other program that exists to advocate for and represent these individuals. We're the only program that fulfills this function. We're federally mandated, and we derive our authority from the Older Americans Act of 1965 as amended in 1978. And all our services are unduplicated, confidential, and free of charge. So what does an ombudsman do? Volunteer and staff ombudsmen make unscheduled, unannounced biweekly visits to 19 nursing homes and monthly, bi-monthly visits to 225 assisted living homes and board and care homes here in Ventura County. There are 244 total facilities that house about 7,500 residents. The ombudsman investigates and resolves complaints made by or on behalf of these residents, and we try to resolve issues at the lowest level. But if that's not possible, we refer our complaints. We have no problem with escalating a complaint if we can't get the results that we need for that resident. That we don't cite or fine. We're strictly watchdogs, but state licensing does cite and fine facilities when they find deficiencies or any type of an issue that might violate a resident's rights, care issues, neglect, abuse, that type thing. So they have the authority to cite a facility and fine a facility, but we do not. Staff ombudsmen provide pre-placement counseling. So if you have someone in your life who needs placement, they can call our office, they can email our office and speak to Vicki Odell, who is our pre-placement counselor. And she's a wealth of information regarding placement in long-term care facilities. So that is the service that we do provide. And we provide about 300 caregivers and care receivers a year with pre-placement counseling. Now, it's not just a one shot. Many of these counseling sessions can go on for weeks. We've had them go on for months. It's not one and done. So the counseling sessions can last quite a while as folks and families try to figure out what in the world they're going to do. So that's a service that we are happy to be able to provide to families here in Ventura County. In order to be an ombudsman, we must complete a mandated 51 hours of core training and mentorship. So that's about 36 hours in the classroom and 15 hours out in the field. We also have to be cleared by the FBI and the DOJ and fingerprinted in order to be certified by the state of California. In order to maintain this certification, we are required to complete 18 hours a year of continuing education, and that applies to staff and volunteers. And I want to make a point here that our volunteers go through the exact same training. They have to be background cleared. They have to complete the CEUs. Everything that a paid staff person has to do in order to be state certified, a volunteer must do as well. So there's no differentiation between our paid staff or our volunteers. Where do these folks live? 1,837 live in 19 nursing homes. So do the math, 60% of these individuals have no visits. So if the ombudsman isn't there, isn't coming into the facility, isn't visiting these residents, they don't see an outside visitor. 5,537 live in 225 residential care facilities for the elderly. And then that includes your large assisted living that can be up to 500 beds, and your small board and care homes that are usually around 6 beds. Okay, what's the difference? We get this question a lot, especially families don't really understand the difference between a skilled nursing facility and a residential care facility for the elderly. And we call them nursing homes, but the legal name is SNF, for skilled nursing facility. And in California, we call all assisted living facilities and little board and care homes, we call them residential care facilities for the elderly. So that's just the differentiation we have here. The license that these facilities receive for the RCFE, which is the social model, that's community care licensing, and that's through the Department of Social Services. The skilled nursing facility is a medical model, and that license comes through the Department of Public Health, Licensing and Certification Division. In a 6-bed, and the census in an RCFE is a 6-bed or higher. And in the skilled nursing facility, it can be up to 200 beds. The staffing, there's no formal training required in an RCFE unless a med tech. A med tech does have to have some training. And in the skilled nursing facility, an RN, LVN, and CNA. And there's usually a medical director, and there's 24-hour coverage in both facilities, or they're supposed to be, not always, but that's the requirement. Care. In the RCFEs, it's activities of daily living, which means laundry, meals, medication management, just activities that an individual may have problems doing for themselves, cognitive impairment, they need someone to manage their medication. And in the skilled nursing facility, there's 24-hour RN nursing monitoring, and the treatments can include injections, tubes, IV therapy, that type thing. Profile. In your RCFEs, mild to moderate physical impairment and mild to severe mental impairment. But the resident's free to leave the premises, and they do. In your SNF, the multiple physical mental impairment, non-ambulatory most of the time, strokes, arthritis, dementia. Payment. This is where it gets very difficult for families. In your RCFE model, it can be up to $10,000 a month. In your skilled nursing facilities, 7,000 is about average. In your RCFEs, it's private pay. And this is a real shock for families when they see this, because they have no clue that it could be that expensive or that it is private pay. In the skilled nursing facilities, there's limited Medicare, insurance, or private pay and Medi-Cal. So most of our individuals in the skilled nursing facilities are Medi-Cal recipients. Restraints cannot be used without a doctor's order. In the RCFE, it must be reviewed every 30 days. And in the skilled nursing facility, they need a doctor's order, and the restraints have to be released every 2 hours. So that's a comparison of the types of care facilities that we cover. And as you can see, there are a lot more individuals in the RCFE than in the skilled nursing facility. Okay. What are some misconceptions about the ombudsman? We are directed by state and federal law to investigate and resolve complaints, monitor the long-term care system, and work toward improving that system. However, there are many others in the long-term care system who are providers. They're care providers, case managers, and they may not always understand our role. So here are some commonly encountered misconceptions about our role, followed by explanations of our true role. Myth. Ombudsman should just provide social interaction for residents. We are not friendly visitors. I mean, we're friendly, but we're not just friendly visitors. Visiting residents and getting to know them is really, it is such a rewarding experience. And I don't know how many of the folks on this webinar have actually spent much time in a nursing home or in assisted living, but there is just a wealth of history and individuals who've contributed so much to our community who now live in these environments. And it's so rewarding to get to know them and to spend time with them. And they love it. They love to have a visitor. They love to talk about their life. They love to share experiences they may have had. family stories. I remember being out in Ojai once and visiting a lady at one of the nursing homes, and she had come across country in a covered wagon and had lived in a dirt adobe house, and found out talking to her, she was an incredible artist, but there were no paintings in her room of her own art. And we found out that her daughter just didn't think she wanted them, and she did. And so we talked to the daughter and had her bring some of the paintings and hang them in her mother's room. And they were just beautiful. It may have been her granddaughter at that point, but just so beautiful and enriched her life so much to have those paintings around her. So these are things that we do that may not seem like a big deal, but they really increase the quality of life of individuals who live in these environments. So we do visit residents. It's very rewarding, but our primary function is to actually go into these homes and for their a lot of isolation, and to open them up for scrutiny. That's what we're there for. We have a purpose that we are to identify, investigate, and resolve complaints made by or on behalf of these residents. So we seek resolutions to their problems or issues, but we also realize that this is their home. They're probably never going to leave here. So whatever we can do, and it may seem like a small thing, like, okay, my coffee was so cold this morning I couldn't drink it, or they brought me meat and I'm a vegetarian. Those are big deals. They may not seem like a big deal, but when you live in an environment where everything's been taken away from you, where maybe you've left a home where you've had an animal, you've had a pet and you couldn't bring your pet. You had your things around you, things that were personal and meant a lot to you. You don't have those any longer. So any little thing, big thing, anything we can do, that's what we're there for. So we're not just friendly visitors, but we are friendly. And we do try to get to know the residents, and we do try to get them to trust us so they will tell us what their needs are. Another myth, ombudsmen should be neutral third parties. We are not neutral. The federal mandate that governs the ombudsman says we are to be express wish advocates. That sets us apart from mediation, from mediators. We're there for that resident, and this was created on purpose. When the ombudsman program was created under President Nixon, one of the things that they wanted to do was to level the playing field, because they realized all the power was on one side. It was on the side of the nursing homes and of the nursing home owners and the administration, and they wanted that playing field to be leveled. So the federal mandate that governs us says we are to be express wish advocates. We may not always agree with some of the things these residents want, but our job is to advocate for their express wish. We're neutral when we investigate a complaint. We have to get all sides of the story. And if we don't, then we're not going to arrive at the right conclusion. So we realize that we have to be neutral when we're investigating a complaint, when we're gathering information, but we have to use that information to advocate for the resident. Residents just stir up trouble. Okay, we do get accused of that quite a bit. We do seek to resolve complaints and problems on behalf of residents, and we try to prevent little things from blowing up and becoming big things. Many little molehills can be fixed before they become mountains. And that's one thing we find, that when we go into the facility and the residents start opening up, talking with us, we can be like the early warning system for the facility. We're not regulators, and we don't write public reports with findings, and like I said, we don't impose sanctions, but we work informally to resolve problems with the long-term care facility. Residents will complain to us when they won't complain to the facility because we are bound by confidentiality. We cannot discuss their complaint or do anything about their complaint without their written consent. And we explain that to them. So they're much more willing to talk with us. We don't get ahead of them by running to some powerful person and bringing their complaint. We let them know that we're going to only take action as you give us permission to take action. And that makes them feel very comfortable in actually sharing some of their issues with us. Sometimes we get accused of creating the problems, but we aren't creating them, we're just discovering them. And we try to make that very clear to the facilities, to the administrators. We're not here to cause you problems, but this is a problem that you need to fix. And if you don't fix it, it's going to get bigger and it's going to get worse. So we try very hard to work with the facility. We're not trying to escalate issues, but we're going to advocate for that resident. That's our job. Myth, ombudsmen need to work with the facility when it is in the best interest of the resident to do so. Whenever possible, as I said earlier, we're going to advocate for what the resident wants, even if this is not in the resident's best interest. I'll give you a great example. We may believe smoking is bad for our health, and it is, but residents have a right to smoke. And when you've been smoking since you were 30 and you're now 92, and you want to go outside and have that cigarette, and the facility, someone's saying, no, you can't, it's not good for you. Yes, they can. They have, if they lived in their own home, they could certainly have their cigarette. They could have their sugar. If they want sugar donut, they can have a sugar donut. If they don't lose their rights as an individual when they move into a facility. And so many times, even residents feel they've lost all their rights, that they can't ask for things, or they can't ask for alternate meals. They can ask for an alternate meal if they don't like what's being served. They can ask for activities that they enjoyed. Maybe not everybody wants to play bingo. You know, not everybody wants to watch baseball or football on television. So residents have a right to have activities that they enjoy. The resident is our boss. And because we're bound by these strict rules of confidentiality, and we explain that to the resident, they will talk with us and they will share with us when they won't share with anyone else. So we have to be very, very respectful. And sometimes it gets very difficult when a resident brings an issue to us and we absolutely feel it must be reported. It may take us a while to get that resident to agree. And a lot of times we will be able to approach it. Well, if you're having this problem, other residents are probably having the same problem. Let me do a little checking around. Let me see if other residents' call bells are not being answered for hours. And then we can do what's called a group complaint, and without revealing identity. But sometimes we have to work and very hard and be very persuasive to get a resident to finally allow us to take action on their behalf. And that's frustrating for us. That's very, very difficult for us because many times we want to take action, but we have to keep reminding ourselves this federal mandate was put in place for a reason, and that was to protect the resident. And as many residents have told us, you're not here at 3 o'clock in the morning. You're not here when that caregiver ignores me and won't come help me because I complained. You know, you're not here in my home when all this is happening. So we have to respect their rights and work with them and try to achieve the result they want without compromising their privacy. So that gets difficult, but that's one of the things we have to do. Ombudsmen do not understand the pressures and financial constraints. We don't advocate for facilities. We will work with facilities, but we advocate for the interest of the residents. We want the facility to be responsive, but we cannot allow the facility's concerns to limit our advocacy. And facilities will try to bring the ombudsman into their policy making, into their administration policy or their structure. We've had facilities say, well, this resident hasn't paid for 3 months and they owe $30,000. That's not our problem. That's your problem. Our problem is to advocate for the residents. We're not a bill collector. And or they'll say, well, this employee, we want you to talk to this employee because maybe they're doing something. Maybe they're talking on the phone too much, or that's not our job. You know, that's your job. You run this facility, you manage these employees. We're not here for you or your employees. We're here for the residents, but we will work with you. You know, we want to work with you, but we're not here to be your advocate. We're here to be the resident's advocate. So myth, ombudsmen are volunteers who do not have the professional background or training necessary to understand the difficult medical issues. I just have a real problem with this. We are not regulators. Our ombudsmen come from all walks of life, but we are the consumer presence in long-term care. We were never intended to be another layer of government bureaucracy full of experts. We are change agents, and we provide routine checks and balance to bureaucratic power while reinforcing the policies that do work. We serve in these long-term care facilities because we are concerned about our neighbors. Our neighbors in these facilities are invisible. I don't know how many of you know, unless you are working in this field, unless you are a volunteer with the Ombudsman Program, how many of you know people who live in nursing homes or who live in assisted living? They're invisible to most of our community. So we go into these facilities because we care. We're concerned about their well-being. And we may learn about their medical condition, but always, and we can't do that without the written consent, by the way. We cannot look at any medical records unless the resident gives us written consent to do so. But we always have to be concerned about whatever the resident wants. They're our boss, and we have to be concerned with them. So let's talk about a specific situation here. I'm gonna talk to you about, I've shared this over time. It's just one of the most incredible classic examples. We have many, many others. But this one was so egregious and so horrid that I want to share it because it shows what can happen to anybody, any one of us. If we don't have a sponsor, like my brother calls them sponsors, or we don't have an advocate, we don't have a family member looking out for us, or we have a family member who doesn't want what's best for us, they only want what's best for themselves. This is a story about Stephen, and he, 83-year-old, he was World War II veteran. He was a retired steel worker and school bus driver who lived in Ohio. And he almost lost his freedom and his life when he came to Ventura County. And this is his story, and you can't read it because it just goes on and on and on. So I'm going to tell you, paraphrase what happened to Stephen. Stephen lived in Ohio with his common law wife, Mary. And Mary went to Florida to visit some family. And while she was gone, Stephen decided to have knee surgery. He played golf, and his knees were starting to bother his golf game. So he had this knee surgery, and he did not do well with the anesthesia. He started to hallucinate, and this happens. We've seen this happen so many times. It happened with my own mother. They don't do well with anesthesia many times because they lose oxygen and during the process, and their brain can get a little bit, they can get very confused. And so Stephen had hallucinations. His daughter, who lived here in Ventura County, went back to Ohio and brought him out via car just after surgery to Ventura. And he had given her financial power of attorney, and she sold his house. Yes, while Mary's in Florida. So she sells his house, and of course, Mary had no place to return to. And Stephen came out here, lived with his daughter, and decided he wanted to go back to Ohio. So he went out looking for an attorney. He went downtown. His daughter, he lived at one of the beach communities, so he found his way downtown Oxnard, and he was trying to find an attorney, and he got lost, and he could not get back home. So she was able to get him named a wanderer, and she had a psychiatric diagnosis that Stephen was a wanderer and that he needed to be in a secure facility. So he was put in a facility. Now we don't have a locked facility in Ventura County, but we have what's called delayed egress, where if you go through the door, bell rings and everybody gets notified that somebody just left. So that was the facility he was in. And that's where Ombudsman found him, there in that facility. And the Ombudsman, who was 83 herself, was visiting him, And she came in the office and she said, I don't think he belongs there. She said, he's as clear as a bell. And she said, he gave me phone numbers for family, daughters in Texas, and he wants to go back to Ohio. And I don't know why he's even here. So I went out and met with him, and I took some of my staff so we could all evaluate him. And we felt the very same way. Why is this man here? And why are they giving him antipsychotic drugs that he's refusing, which he could? Why are they keeping him kind of under lock and key and preventing him from going anywhere? They wouldn't let him call anybody. So we got involved, and we found out that he was very, like I said, very coherent. And so we began to advocate for his rights and a reassessment of his mental state. The daughter was very, very unhappy with us and threatened us and sent letters to our board of supervisors. I think Victoria Jump received a letter. Our state ombudsman received a letter. Governor probably received a letter. She wrote everybody she could write. She threatened us with lawsuits. She said that we were ruining her life. And during this time, we didn't have anyone as far as licensing. They didn't stand with us on this because they believed the diagnosis. And this is where it gets very mushy, because he did have some issues from the anesthesia, but that had cleared up. But the reassessment was so important, and we were able to actually get it all lined up, and then the daughter got it canceled. So his reassessment was canceled. He ended up actually being taken out of the county and actually locked in a psychiatric ward in Northridge, at Northridge Hospital. We worked with the ombudsman we didn't know where he was. He disappeared. And we worked with the ombudsman in Los Angeles, and we were able to find him. And he had been locked up, and now he was truly locked up. He was in a psychiatric ward. And this is where it just became so difficult to advocate for him, but we kept advocating for him. We called him every day. He would cry on the phone. And we kept working, just working with him. And the daughter applied for conservatorship, and we were able to get assistance from our public defender, Mary Webster. She's no longer with us, but she's moved away, but she was here at the time. And we were able to get him back to the county. So he did get a conservatorship, but not the daughter. It was a private conservator. And we were able to get him back into the county. And then he was appointed the public defender. We were able to work with the investigator and provide all the documentation, the research, everything that we could provide, we provided, because he had given us full consent to everything that we could do for him. So he came back, and just imagine this, he went from a locked psychiatric ward in a hospital to a beautiful, large assisted living facility where he could come and go in Camarillo. And he did come and go. And I would visit him there, and he was just a beautiful man. He had created a little altar. He's Catholic, and he had strong faith, but his faith had gotten really weak over this whole process. But he had made himself a little altar out of a basket, and he'd put a little crucifix in it, and a few things that helped him pray. But he told me this was his altar, and he prayed every day. So I would visit with him, and of course he would cry every time I would leave. And we said, this is going to work out for you. You are going to get to go back home. So we did go to court, and a judge who heard the case had really done her homework. And I'll always be grateful for that, because she had read everything. And we were able to get him in front of the judge, and the temporary conservatorship was terminated immediately. And the judge asked him if he wanted to go back to Ohio. And he said, I do want to go back to Ohio. So he went back to Ohio. He was able to recoup most of his savings, but not the cash from the sale of his house or the tens of thousands of dollars his daughter spent during the 6-month period that he was confined. He got back to Ohio, and he did live another 7 years doing things that he enjoyed. He passed at 91 years old. Here he is. This was him when he had gotten the good news that he could go home. So he went back to Ohio and bought a new TV and bought a new car, and I guess continued to play golf until he couldn't play anymore. But that's one of those wonderful stories of the people, just one person. And there have been many, many, many others. We have a case right now we're working with that we're trying to get the gentleman back to his home that he's been kicked out of by a stepson. And so that's another case that we're working with Adult Protective Services on, so he can go home. So there are many, many of these cases that we have had over the years. But Stephen, to me, is just one of the most classic because it took so much tenacity. It took a team it took us all to work together with the public defender and the investigator and the judge. And it just took so much cooperation to help him, but he was so grateful. And we did have to provide an escort. We did have someone who was willing to escort him back to Ohio, and that worked out. So anyway, he was a happy camper. So one ombudsman, this 83-year-old lady who visited him, made such a difference in his life. And one ombudsman does make a difference. So we serve a segment of the population that would otherwise have no means of representation. We proact and advocate for those who cannot speak for themselves. If we're not there, and that's why I love this program so much, not because I'm in it, it's because I found it. I'm thankful I found it because there's no other program, nothing, no other group that does what this program does. No other group has the authority from the federal government and state government to go into these facilities 24 hours a day and check on these residents. And we have gone in late at night, wee hours in the morning, because of things that we were told were going on. If we're not there, we really believe that most complaints would go unnoticed and unriveted, and the levels of care and quality of life would certainly decline. And we certainly found that out in COVID when we were kept out, our volunteers were kept out of facilities for 13 months. And the only ones allowed in the facilities were staff, and we were only allowed to make window visits and patio visits. When we finally got back into the facilities in April of 2021, we found some horrible situations. Our poster, which is supposed to be hanging on the wall in 4 of them in skilled nursing, had disappeared in some of the facilities. Some of the residents had been so isolated that they were paranoid about even coming out of their room. Residents that the year before had been thriving had declined so much. And we found a whole litany of issues due to the lockdown and COVID. And those of you who were able to attend our symposium on April 7th about autonomy versus safety, I know that this was addressed in detail about how we can never go back to doing that again, that there has to be a way to provide safety during these crises or epidemics or pandemics. Because if no one's there checking on these residents, if the families aren't allowed to come in, it most certainly is detrimental to the resident. Like I said earlier, we're free of charge. We don't charge anything for our services. Everything we do is confidential. We've been involved in some pretty major lawsuits that we can't discuss and where families received a very sizable settlement because of wrongful death. But we can't discuss those because of confidentiality. But we are very grateful for the support we get from the Area Agency on Aging, because we contract the ombudsman program from the Area Agency on Aging and have done so since 1981 when the program started here in Ventura County. And the support we get just is amazing. It's wonderful. And it really encourages us to keep doing the work that we do. So that's greatest need, more volunteers. We're struggling now. When COVID started, we lost, the first few months, we lost 20. We had 55 volunteers going into facilities pre-COVID. And within 6 months, 6 to 8 months, we had lost 20 of our volunteers. Some just did not feel comfortable going into facilities, compromised health, understandable. You know, we do get it. We know that it isn't for everyone. And we don't want anyone to be uncomfortable in this work. So we have lost a number of volunteers. We still have, we want a lot more volunteers. You know, that's our goal, is to get more volunteers. We still have to adhere to weekly COVID testing. And of course, all our volunteers have to be vaccinated, but the weekly COVID testing seems to be a stumbling block for some who would like to become volunteers, but they're just not willing to do that. So those are some of the challenges we're facing right now, trying to recruit volunteers and get them into the program. But that's our greatest need other than financial. But more volunteers really means more eyes, more ears, more boots on the ground. And these residents are going to have better care, and they're not going to be exposed to some of the neglect and problems they've had if we have more people going into these facilities. So that is our greatest need. Who works for us? We have 7 paid ombudsman staff, 4 full-time and 3 part-time. We have currently 35 state certified ombudsman volunteers and an 8-member board of directors. We are a 501c3 nonprofit. So not only do we get funding through the Area Agency on Aging, we also can apply for funding out into the private sector, and we do. We also get funding from the County of Ventura. And we're very, very grateful for all the funding we get because we need it. So our board of directors oversees the program, and they're wonderful. They do a great job. So I see I have a couple of questions. Oh, if you want to contact us, our website is right here, www.ombudsmanventura.org. We're also on Facebook, Ventura County Ombudsman, and you can email me anytime if you have any questions or concerns. And email our office, call us. You may not need us now, but you may need us in the future. And a lot of folks don't realize they need us until they need us. And so we're here. And we do have, like I said, we do have a Facebook page, we do have a website, and you can call our office. We're in the office Monday through Friday from 8:30 to 4. Okay. I see there may be a couple of questions, Ben.
Thank you, Sylvia. What an amazing presentation of such amazing work. I really appreciate you taking the time to share, not only with those who are on the call now, but those who will watch it as it's posted to our website. So really appreciate it. It's amazing work. And what an amazing story of Stephen. Thank you for sharing that. So I'm checking in our official question and answer venue, and I do not see open questions. Oh, we do have one from Kendra. How much time is required to volunteer?
It really is. This is where, I should have talked about that. This is where it gets very flexible for volunteers. We have volunteers who work full time, but they volunteer with us. And so we pretty much they decide, I can handle 3 facilities or 3 board and cares or 4 board and cares. And so we will work with them to make the volunteering experience work for them. We have nurses. We have a nurse who works, she's part-time, but she's still on call. So she's also a volunteer. Many of our volunteers are very involved in community, other community programs and others, senior service programs. So they're also they're busy. You know, they serve on boards, and they find satisfaction in doing other having other opportunities. So we will work with our volunteers when we interview someone, a candidate, and I didn't talk about that, but every candidate has to be interviewed because we want to make sure that we get the right person in this position. And we find out, you know, how much time do you have? Do you have 10 hours a month? Do you have, how much time do you want to give? I guess is the question that we ask. And, you know, we work with them. They may say, well, you know, starting out, I don't feel comfortable more than so many hours a month. And that's fine. You know, we will work with you. And we have found some of our volunteers who said that, well, maybe I can do 10 hours a month. Oh my goodness, I read their reports and they're doing 20 hours a week, you know, but we haven't asked them to. It's just what they want to do. We don't require any set number of hours. We do reimburse mileage at the federal rate or any other kind of expenses. During COVID, when a lot of the sites, some of the COVID sites had long waiting lines, and our volunteers were having to struggle to get their COVID tests, we purchased COVID tests for them, or we let them go on Amazon and buy their own, and then we reimburse them. I mean, we want to make life work for them as a volunteer as much as possible. And then we do provide the 18 hours a year of CEUs. We provide for them. Either we do it ourselves or we do it through webinars that have subjects that would, you know, educate them, enhance their training. So yeah, we work with what we have, you know, what we can get. So yeah.
Thank you, Sylvia. And if people are interested in volunteering, of course, they can contact you by email or visit the website.
Yeah, they can actually download the application right off our website.
Perfect. So any of those listening who are interested in volunteering, feel free to go to www.ombudsmanventura.org and download that application. So Sylvia, if I'm a family member, there's an older adult who's part of my family who's in a skilled nursing facility or a residential care facility, what questions should I be asking about their care?
If you are a family member placing a loved one?
Yeah.
Okay. Well, it usually starts out with, we have to find out what your loved one's needs are. I mean, do they need skilled nursing care? Do they need 24-hour medical care? If they do, they need a doctor's order, by the way, in order to go into a skilled nursing facility. We would want to know what their physical and mental capabilities are. Finances, you know, we need to know what can they afford financially. This is the big hurdle because families are not prepared to pay what is, you know, what they have to pay. And so it's that's a hurdle. Geographic area, where do you live? You would want to be near your loved one. You don't want to place them all the way across the county where you may not be able to get to them if they need you. And also during any type of disaster, if we have an earthquake, if we have a fire, you don't want your loved one, you know, 45 minutes away. So we talked to you about the importance of placing them geographically. And maybe there's a stellar facility over, you know, 3 cities over, but, and they give great care, but can you get there often? You know, you might be better off placing them in a facility that maybe isn't quite as stellar, but if you're there every day, or if you're there every other day, they're going to get better care. So, you know, we encourage families, place your loved one, and we provide a list. That's the other thing I didn't mention. We provide a list of all the county facilities in the county. And on that list, it has the contact information, phone number, how many beds they have, the address, the administrator, email, his or her email. And we provide that to all the families. And that list is constantly being updated. In fact, licensing tells us our list is better than what they have on their website, because we have volunteers who go to a facility and they go, oh my gosh, the facility's closed. There are no residents there. Well, licensing didn't even know because the facility is still licensed. So, you know, we share a lot of information with licensing, but we would provide that list to you. And then we would ask you to download, there's a checklist on our website, a facility checklist, and to download a few copies and go out and visit these facilities and take that list with you, because it'll be your little tickler. It'll tell you what you need to be looking for, what, just go down your little list and it'll help you. We taught it, the big hurdle, Ben, is finance. That's the biggest issue people have, because if you really are, if you can qualify for Medi-Cal, great. And if you're wealthy and you can pay, great. But it's the people in the middle who can't, they can't qualify for Medi-Cal. They make a little bit too much money, but they sure can't afford $6,000 or $7,000 a month. So those are the folks that really have a hard time, that struggle. And the ones we try to help everyone, but our heart really goes out to those who are stuck in the middle, and so many of them just, they don't have anywhere else. They don't have another option. And that's part of the frustration that we feel, because we don't have, waivers for these folks to go into these facilities. So we would really, we have forms we have to fill out that are questions we have to ask. But we would want to know everything we can know about your loved one and about you, and also what's important, to you and your loved one, and just try to help you refine your search. We're not going to recommend a particular facility, and I'll tell you why we won't, because a facility can be great one day, and people change, administration changes, ownership changes. And we could say, oh, Ben, take your mother here. This place is great. Well, a month later, you're calling us saying, what in the world? Why did you send me there? And that changed. So what we do is we encourage you to empower yourself. Go into the facilities, check them out. How did you feel? Would you want to live here? Would your loved one be comfortable here? So, and then we tell you to call us back. And that's why many of these counseling sessions go on, because it's like, go check this out, call us back. Check this out, call us back. If you have any questions, call us back. And so we do spend quite a bit of time, with the families. I wish we had a magic pill or a wand. We could say, yeah, here's this beautiful state-run facility that you can get in with your Social Security payment, but we don't have that. So that creates a problem.
So Sylvia, I'm hearing that if I have these questions, I should call or visit your website, get these resources, and that'll start me on that process, and you'll be there as I have questions.
Yeah, we're here, and just so you know, we're doing a big revision of our website, and we hope it's going to be a whole lot more user-friendly and a lot more informative and educational for folks. So that's something we're going to be doing. But yes, our website's up, and you can get a lot of information off our website. But because this facility list can be changed weekly, sometimes we don't put it on the website, because by the time we get it up there, we're revising it. So, but you can get that email to you right from our office. It's easy to get.
Perfect. What an amazing resource. I'm going to check and see if we have any other open questions. Doesn't look like it. If anybody wants to, feel free to throw it in. And if not, I'm going to be selfish and ask the last question, which, Sylvia, you've been doing this for a while. So
22 years.
You've seen some big changes.
Yes.
Step back. What is the big picture for long-term care in California? What are the challenges you see? What are the changes you're excited about? What's the big picture look like to you?
It's daunting. And I'll say that in as positive a way as I can. It's daunting because people are aging and not aging well. We have a lot of individuals who have made some poor choices. Their health is not what it could be or what it should be. And so they do end up having to live in an environment that maybe they don't want to live in or never thought they would ever have to live in. The changes I have seen, which have been probably the most I guess challenging for me. When I came here 22 years ago, the population we served were World War II veterans, Korean veterans, um, incredibly grateful people. Just, they really, really appreciated everything we could do for them. And the changes I have seen happen, and they were older. We're talking people in their 80s, the 80s, 90s. And now, we have this much younger group of people who have come into the facilities who are, they don't have anywhere else to go. It isn't as if they have a place, but, many of them have been homeless. Many of them have addictions. We didn't deal with that before. We're not, counselors for drug addiction or alcohol addiction. So that's one of the changes that I've not been happy with at all, because these individuals should have a place, and it's not a nursing home. It's not being housed with individuals who are in their 90s, who are frail and vulnerable and disabled. And so that's one of the changes I've seen that I'd love to see us do something about. I'm happy to see that there's been more attention on aging and aging issues. And I think, our AAA is at the forefront of really trying to bring attention to some of the issues of aging. And I'm glad to see that the California Department of Aging, the master plan for aging, I'm glad to see things are happening like that, because I think we need to bring a lot more attention to this population. It's easy, out of sight, out of mind. I don't know, people just don't go into nursing homes. They don't go in, okay, let me go to a nursing home today. No, that doesn't happen. And these individuals are invisible for the most part. So I would like to see more visibility. I'd like to see more community involvement. I'd like to see more churches. I've been disappointed that we haven't. I know some churches do the visitation, and that's wonderful. And, I understand that some churches do that, but I'd love to see more churches involved with this population who they're thirsting, for interaction, socialization, involvement. So I'd like to see that. I guess there's no easy solution to some of the issues we face today with homelessness and drug and alcohol abuse and addictions and that type of thing. But it is tragic to see really young people in their 30s coming into facilities who have abused themselves so badly that they have to be in a nursing home. That's heartbreaking. So those are the things that we see and deal with. But it's I think it's just where we are as a society, and we have to do what we can do to make things better. And that's why I think this program and other programs that serve our seniors are so important, because they are working. We're all working together to enhance the life of these individuals, and that's all we can do.
Well, Sylvia, thank you for all that you and your staff and volunteers do to make those who are too often invisible visible, and to lend your voice for their focus. Kendra, I wanted to let everybody know, somebody who works primarily with seniors through CTAP. Really appreciate ombudsman's, and this was great to get more information. Thank you.
Well, thank you all. Thank you for allowing me to come and share this today, and very, very much appreciate it. Thank you, Brent.
Our pleasure. Thank you for taking time. So everyone, this recording will be available shortly on the vcAAA.org website. We have this series once a month. So the next session will be June 16th on Adult Day Healthcare Programs. So if you're interested, feel free to join us on June 16th. Again, that'll be at 5. You can sign up for the ongoing webinar series. Sylvia, thank you again for your time.
Thank you, Vin. Thank you, Monique. Bye-bye. Thank you, everyone.